Hello, everybody. My name's Sarah Maurer, and I am a nurse practitioner with the endocrinology department as well as the non surgical weight loss program. So, tonight I am going to do a presentation on weight management and diabetes, which is a combination of both of my roles essentially. But before I get started, I just want to thank Maria and Dr. Baker for facilitating and all of you guys for coming tonight to the support group. So, with that, we'll get started. Okay. So tonight we are going to be reviewing insulin resistance, type 2 diabetes, and the importance of weight management in as a diabetes treatment. So we'll start with what is insulin resistance. So to fully understand insulin resistance, we're going to start from the very beginning, and that is carbohydrates. So when we think of carbohydrates, we think of pasta, breads, fruit, pancakes, cereal, potatoes, the list goes on and on. And these carbohydrates foods are forms of energy for our body. And if I have seen any of you for diabetes in clinic, I often talk about carbohydrates in the context of diabetes as Goldilocks because we need to find the right amount of carbohydrates. You don't want too many, but you also don't want too few. When we talk about carbohydrate metabolism, what happens is our body, when we eat carbohydrates, our body breaks down or converts most of those carbohydrates into glucose. And then glucose is then released into the bloodstream until a key hormone, which is insulin, comes to help transition those carbohydrates or glucose that we eat into energy for our cells. So, insulin is this hormone that's created by the pancreas. It functions as a key essentially to transport the glucose into the cell. So, as you guys can see on this very scientific and technical slide, essentially there's little doors on the cells that are called insulin receptors. And the hormone insulin, which actually functions as a key, opens up those cell doors and allows in the glucose so our cells can utilize that glucose as energy. So when we look at this process in its entirety and its functioning normally, this is kind of a diagram to depict what that looks like. We eat carbohydrates. They are then converted into glucose. Glucose is then transported into cells via the hormone insulin. And then all of our cells in the body utilize the glucose for energy. Now, the problem comes when we have too much carbohydrates or too much sugar that's ingested. And this leads to too much glucose in the bloodstream and eventually results in insulin resistance. So here's an analogy that I thought was helpful to understand the concept of insulin resistance. I am a notorious overpacker, so I can relate to this, and I hope that you guys all can as well. So if you look at this slide, the suitcase represents a cell, and the extra clothes that are being packed into the suitcase would represent sugar or glucose. Now, as you can see, there's way too much glucose or clothes being packed into the suitcase or the cell. So the excess clothes that don't fit into the suitcase are like excess glucose that's unable to get into the cell and instead is hanging out in the bloodstream, causing high blood sugars. Now, if you are an expert packer like myself and are effectively able to overpack, and by stuffing everything into your suitcase and zipping it up tight, you know that once it is, the overpacked suitcase is zipped shut, it essentially kind of maintains, or it has a different shape and it's not quite the same as it originally was. So this I liken to what happens to cells. So once these cells have been packed heavily with glucose and sugar, the cells like start to change, and specifically the insulin receptors, or those doors that we looked at on the previous slide, those change on the outside of the cell. And when the doors change, or when that shape of the cell changes, those keys, the insulin keys that are floating around, don't work to open up the cells and let the glucose in. So your pancreas is making more insulin to compensate for the extra blood sugar or the glucose in the bloodstream, and more keys are being made, but the locks on the doors have changed, so the keys aren't working, and the cells or the doors are resistant to the keys. So that is the concept of insulin resistance. Now, when we talk about treating insulin resistance, there's three main forms of treatment that we focus on. The first one is diet. So there are several diet changes that can help with insulin resistance, but here are a few recommendations. Avoiding processed foods because these are digested very quickly and can cause high blood sugars. If we avoid saturated fats, they can actually also worsen insulin resistance. Eating high fiber or mixed meals with protein, carbs, and fats can actually slow digestion, which will give your pancreas a break. And so it doesn't have to work so hard. We talk about eating low glycemic carbs, which are essentially slowly digested carbohydrates, and that can also give your pancreas a break. And then if you just limit your carbohydrates and sugars, that is just limiting the amount of sugar that's in your bloodstream and in your body, and that reduces the amount of insulin needed. The second way is exercise. So physical activity can help the body better respond to insulin, and it improves insulin resistance because your muscle cells just use up that extra glucose from the bloodstream. So it burns off the extra glucose. And the third is a combination of both diet and exercise, and that's weight loss. So weight loss is really important in reducing insulin resistance. And one interesting study was the diabetes prevention program. And what the DPP showed is that a weight loss of 5 to 7% actually reduced the risk of developing type 2 diabetes by 58%. So we really can see how important it is to focus on weight loss as a treatment and prevention for diabetes. Now, if diet, exercise, and weight loss changes aren't implemented, insulin resistance can eventually turn into diabetes. So this slide shows us how that process can happen. The pancreas, like I said, it'll work extra hard to make extra insulin to make up for the insulin resistant cells and when there's too much sugar or glucose in the blood. Over time, blood sugars will become slightly elevated, but not so high that you are technically diagnosed with diabetes. And during this time frame, we call it, or it's classified as impaired glucose tolerance or just prediabetes. But over time, if weight loss, diet, and exercise changes aren't implemented, the pancreas and the beta cells of the pancreas tire out and they're unable to keep making extra insulin. So as a result, that excess glucose in the bloodstream becomes significantly elevated, and then it's classified as type 2 diabetes. Here are just a few stats from the CDC about diabetes and the impact it has on in the United States today. So there's approximately 34.2 million Americans, or just over 1 in 10, that have diabetes. 88 million Americans, or approximately 1 in 3, have prediabetes. And as you can see, the majority of people with diabetes have type 2, but there is a small percentage, 5 to 10%, that have type 1 diabetes. Now, when we look at diabetes treatment, there are a number of wonderful treatment options available for diabetes on the market, and some of you may even recognize some of these treatments on the slide. And the exciting thing in the diabetes world is that there's always new developments, new treatment options and advances. So we are super excited about that in the diabetes world. But even though we have these great treatment options and we use them every day, tonight we're going to focus more on the most important treatment option, which is diet, exercise, and weight management. So when we think of diabetes as a condition, the condition is essentially insulin resistance, which we just talked about. When we look at the symptoms of diabetes, the symptoms would be high blood sugars. All of the treatment options that we have, or a lot of the treatment options, are primarily targeted at treating high blood sugars. And this works great and is exactly what we need to do to bring the blood sugars down. However, we should really be focused on treating the condition of diabetes, or the insulin resistance, which is done through diet, exercise, and weight loss, as we discussed. So to look at this another way, we could take the condition of strep throat and look at the symptoms of strep throat, which we have are fever, sore throat, fatigue, difficulty swallowing. And we treat those symptoms with Tylenol, throat spray, lozenges, soup, rest. But if we really want to treat the condition, which is actually the bacterial infection, we'll need an antibiotic. Or if we look at a car with an oil leak, the oil leak is the symptoms. And to treat the symptoms, we can keep adding oil, which will help the car continue to run. But really, the best thing to do would be to treat the underlying condition or fix the root of the problem um, to prevent the oil leak. All right, so if we look a little bit further into treating insulin resistance and type 2 diabetes with weight loss, there was a study that was published back in April 2017, and the study reviewed a total of, or a lot of weight loss data from 58 studies, and the studies all looked at weight loss from diets, weight loss medications, or bariatric surgery, and it looked at that in overweight patients with type 2 diabetes. And the data showed a positive impact of weight loss on A1C. A1C is, for those of you who don't know, a measurement of average blood sugar over the course of 3 months, and it's a lab value we use to monitor diabetes. The study showed that for each kilogram, which is 2.2 pounds of weight loss, there's an A1C reduction of 0.1 percentage points. So this is super important and interesting data that we like to focus on in clinical practice, and it supports supports weight loss as a treatment for lowering A1C and treating diabetes. And really, you can take this information and take it one step further to look at other studies and to design other studies to further examine the relationship between weight loss and diabetes, like this next study that looked at weight loss and diabetes treatment more closely. It was called the DIRECT trial, and this one was published in February of 2018. And the study included participants ages 20 to 65, and they all had type 2 diabetes. They weren't taking insulin, and they had been diagnosed about 6 years prior to the study. The intervention group was in a really intensive weight management program. They had they were allowed 850 calories per day with a total meal or diet replacement. And they did that for a minimum of 3 months, but up to 5 months as tolerated. They did have a food like reintroduction process and also included structured weight loss support throughout the 12-month program. And the findings of this trial or this study were impressive as well. Um, the people in the interventional group lost 33 pounds, or 24% of them lost 33 pounds, and 46% of participants achieved diabetes remission, which is what they described as, or they classified as, an A1C of less than 6.5% and being off of diabetes medications completely for at least 2 months. So this is pretty profound and just shows how effective weight loss can be on treatment of diabetes and, in fact, even reversing diabetes. All right, so in conclusion, I hope that my presentation was able to highlight the importance of weight loss, diet, and exercise in diabetes treatment. These lifestyle changes have a significant impact on insulin resistance, preventing diabetes, A1C reduction, and even can achieve diabetes remission as seen in the DIRECT trial. And with that being said, one final thought for all of you on the weight loss journey. So the road may not always be easy, and I think we all understand that, but just encourage you all to never give up, because as you're traveling down the weight loss path, you might have a bad day or a bad week, but it's okay. I like to liken it to a flat tire. So if you get a flat tire, it's disappointing and frustrating, but generally you don't just give up and pop the other 3 tires and throw the car away and give up on your journey entirely. Instead, you fix the flat tire and keep on going. So just a reminder to keep up the great work and never give up. And here are references from my presentation, and at the bottom, there's also citations for the studies if any of you wanted to look at those in more detail. And thank you.